This is the Emergency Medical Minute.
Okay, very quick. I would file this under the no surprise folder. Study from the journal Pediatrics looking at antibiotic prescribing for basically colds or upper respiratory tract infections. Comparisons between telemedicine versus urgent care versus primary care. So obviously now there's kind of a big increase in the availability of telemedicine evaluations where you can see your doc or see a doc and be evaluated and prescribed medications via essentially Skype. Very convenient. You can do it when you want to, very timely. So this study retrospectively looked at visits divided between telemedicine patients, urgent care patients, primary care patients, didn't look at ER patients that all ended up having a diagnosis that was essentially viral URI. These were pediatric patients. So telemedicine patients, viral URI, typically antibiotics, what do you think? 52% of the time. So 52% of the time. For urgent care, 42% of the time. Primary care, 30% of the time. And then they went back and they looked back, and I misspoke. Not all of these were viral URIs. They were upper respiratory tract infections. They went back and they looked at the patient's diagnosis, meaning whether that diagnosis warranted antibiotic use. So otitis media, antibiotics, okay. Viral URI as a diagnosis, should not be getting antibiotics. And surprisingly enough, 4 in 10 of the telemedicine diagnoses would say viral URI or something that was a viral infection when they actually got antibiotics. So the diagnosis and the treatments were discordant. So obviously raises the risk of resistant antibiotics and the risk of side effects just from resistant germs and resistant germs and the risk of side effects from antibiotics. So not surprising, but something to be aware of since that's more prevalent today.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.